We're very pleased to have Zahal Levy as our speaker this morning and we'll have from MediHelp International. Now, I understand that Zahal is giving up his time. He could be going to the beach, which is very close to where he is in Israel. But instead, he's speaking to us. A few points of administration. Zahal does have a presentation and will share his screen on that. We are recording this session, and you'll see a small recording sign. It will be available on the website of the Chamber after this particular event. We're a reasonably small number, but a select number, and so therefore any questions that people wish to ask, please do ask them. You have a chat button there on the bottom, but also I know Zahal is quite happy for you to ask questions live during his presentation. So Zahal, welcome to this morning's webinar with the BRCC. Thank you very much. Please tell us how people are reacting to medical insurance in the state of the current crisis with COVID-19.
I will do so, but I don't want to miss the opportunity to say thank you to the British Chamber, which is responding very nice to health insurance. We've been doing some conversations and events with the Chamber before. I must tell you that your chamber in Romania is a very active organization. We are present in other countries in Europe, as I'm sure you know. And then it is, if I compare the amount of activities, the intensity of the activities, the seriousness, the depth, the comprehensive approach, the professionalism, the persistency, many things I can say. This is not just to be flattering now, but it is really what I think about your activities, and this is a very big privilege for us to be a member of this organization, and thank you very much for giving us the opportunity to share this, our ideas and our life with you. So, to your question, yes, there is a growing interest in health insurance. We see this all over Europe. Specifically about Romania, it is a lot to do with the situation and could have been better had the Romanian government given it some more importance. I think that most of us know health insurance from other countries. We are all connected to countries in the west side of the continent or in other places. And there are actually three models that we know that are health insurance related. One of them is the American model, means the state doesn't care about your health unless you care about it. It will be your problem. There is a middle model, which is in my country and in England, and in France, and in other countries that we know. The middle model is a combination of the two. It means you must pay taxes to the national health system, but you should complete your own, and you have to buy your own supplementary insurance or to cover for whatever things that you want in order to make sure that you will not fall victim to the administration of the health system of your country. And in many countries, the situation is that the health system, obligatory health system, takes your tax, gives you some kind of a basket of services that usually is not enough, and you would buy your own additional coverages. The third option is, the third model is what we see in Central Eastern Europe, is abonnement, or let's say membership ruling territory, where you are buying a package of services, usually in the framework of your work. It's a tax relieved product, and you are very limited in this package. Namely, you can use only one clinic, and you are subject to this clinic and to whatever services they have on their list. That will be the services you will be able to get within your scope. Usually it's not hospitalization. You cannot travel to other countries. It has many limitations. We're not going to all of them now. but this is the third model. In these countries, health insurance is not in a very big awareness of the public, and usually totally ignored by the governments or by the leaders. So these are the three models that we know, and therefore, if we are now focusing on the state of Romania, surely it falls to the third model. We started about 15 years ago with Bupa insurance company to make a change in this. Very quickly, we grew to a big size. We are market leaders in Central Eastern Europe in private health insurance. We own the biggest portfolio that Bupa has in Central Eastern Europe, but we are not only with Bupa anymore. Actually, we have our own plans that are underwritten by big giants that we sell on our own. They are our plans, our property, sold under our name, which is a very big achievement. And they are now the plans that you can see on the market that are under the brand MediHelp. And I think that in this conversation, we can maybe put some light over some issues to do with the topic that we have today. I'm sharing with you the screen. I will not do this all the time. And as you can see, I have only 2-3 slides. This is not important to have many slides. I think I'm always preaching that in seminars, you should not use a lot of slides, because if you do, then you are making the people bored. They cannot read so much. But just to make a short introduction for those who do not know about us, we are Central Eastern Europe based, although we have customers all across the continent and also worldwide. And we have created our own premium tailor-made corporate plans and individual healthcare plans that we are selling, or insurance companies are selling them under our brand. So for example, if you call Generali Insurance Company now, you will ask for international private medical insurance, you get MediHelp plan. That is already in a few countries like this. In Poland, we have another partner, but this is not important now. And then what is the adaptation to digitalization and to the new telemedicine issues, and what do we offer? We should probably talk soon. But
I think we have a moment for a short pause. Are there any questions so far or comments? Not yet. Well, I think certainly it's impressive what MediHelp has got covered, and I hope that we'll have Zahal back with us very, very shortly. Oh, I can see him waiting to get back in. I'll just admit him. Good.
I guess you
think
like what I
Zahal,
said.
You're back with us. Good.
You didn't like what I said? Did I say something wrong?
There's no censorship in the BRCC.
Just to make a short review of what we are doing. What is health insurance actually? What is our health insurance? Just to put us all in the same line of knowledge. Our health insurance policy covers you for A to Z medical care. Any doctor, any clinic, any hospital, any investigation, any checkup, any imaging process, private basis, everywhere. Anywhere in Europe, or if you pay an additional price, you can get it everywhere in the world. And if you pay the highest price, you can get it everywhere, including the United States. This is in a nutshell the way we work. It means you can have your own medical care tailor-made by your own preference. We don't tell you where to go, and we should be behind you, paying for you, either in advance or after, depending on the case. You always get the money quickly anyway. You don't need to nag, you don't need to wait. You are connected to our customer service office, and then anytime you want, you can have service. This is health insurance. Now I'm ready for the first question.
I have a question.
Or shall I ask myself the question?
If I can ask a question. I was wondering, let's say if you have MediHelp health insurance and you also have two small children at home. Due to this COVID situation, you are afraid to leave the house with the small children for a checkup. How can MediHelp help in this case?
Good. So look, the issue of COVID and the situation that we are now at has made a big change in all our approach, like we did everything with everyone. I think that we have to, first of all, acknowledge and admit the situation is very unclear. And still, everything we shall say today about the virus has to be attached to a degree of modesty. I'm not sure that we can already, you know, you read and you talk about the thing, and you are flooded with information from many experts from all over the world, from all walks of life, and everybody is telling you things. I'm telling you, you read everything with a degree of doubt, with a question mark, and the truth is that there isn't a clear picture anywhere in the world about the virus, about the consequences, about the length of time it will stay with us. For sure, it will have economical effect on all of us. And for sure, it will have economical effect on the health systems. And that will come in the end to the life of everybody. And also, when you say, Michaela, that you are with your children at home, you will be in a very, very serious problem, because you might go to the hospital and it will take you a long time to get attention, not because the doctors are not good people or they don't care about you. It's because they will be very loaded and the place will be very crowded, and you might need to wait for a long time, and there might be in shortage of some medication and some facilities. And the way we are handling it, to answer your question, is to go to two directions that we are developing. Number one is the freedom of choice. So you can go to the place where it's comfortable for you, or where you judge is the most available or comfortable. That means if you don't want to go to the public hospital and you prefer to go to a cabinet of a small cabinet of a private doctor or private expert, that will cost you and we should pay the bill. While doing this, we are actually allowing your children, we're enabling you to avoid crowding up in a small place, in a small waiting room with a lot of people who are coming to that location with many types of disease. Some of them may be contagious, and you don't want to expose your children. Not to mention other things, that you might live far away, you might live out of the city, it might be minus 15 degrees outside, and you don't really want to go, maybe you don't have how to go, and there are many, or maybe you're at work. There are many situations we know very well. The connection between the potential patient to the treating doctor is usually not an easy exercise. And my ideal in life, when it comes to my work in MediHelp, is to convince everybody around me. And I think that when it comes to my team, it's not difficult to convince, but sometimes it is difficult to convince the insurers or the reinsurers or other partners to do everything we can that our product, our services will make everything accessible, easy, tangible, easy to reach. So if you need medical care, you can get it right away. And that's it. And there is no compromise here. So we are now negotiating with a company in Israel for an exclusive royalty for owning devices that you keep at home, and you can transfer some parameters to a remote medical location, where there is a doctor who will read your parameters and will be able to get an initial review about your situation. That is not treatment. That's hardly even diagnosis, but it can give some kind of a relief. So if your child doesn't feel well and you are on the attitude that if he's not feeling well, you want to run to the doctor right away, not take any risks. So we can create for you a middle step where you can have another evaluation or another opinion prior to running and getting yourself to sit the whole night in the emergency room for no reason. That doesn't mean that it works in all situations, but it does mean that you can have a 24 hours access to medical care, which answers the qualification, answers the parameters that I just said, the easiness, the accessibility, the ability to get a fast response for everything that you need. In that respect, this is something that we're investigating with more than one company, by the way, and we are already in a testing stage with some of them, and I hope that during this year we will be able already to have something in the market. As I said, don't put this as an obligation. So tomorrow I see this is financial. Mr. Levy said that this year there will be telemedicine devices for health insurance. I am saying that I hope that we still make it this year. It's on testing. It means there are good chances that we will be able to do it. So these are the two directions. Accessibility means that you can go on your own decision to where you think you can get proper medical care at the highest standard without limitations. So you don't need to think about any financial matter, or at least this is what we can do for you. We can release you. We can lift the pressure that can come on financial issues and let you choose, like you have your own choice, and then you will be able to get proper medical care. And the second story is the equipment, the telemedicine, which is something that we decided to explore and support. And as I said, there are tests done in 3 countries now, and I think that probably it will bring nice results.
Thank you very much. Good.
The second thing is about the government issue. I want to show you a slide that I've been lecturing in Athens this year, and I've showed them a slide which I want to share with you. Not very updated, but can give us some input. Do you see this slide? Are you with me?
Yeah.
Okay. You don't sound sure. Everything is okay here?
We can see. We can see it.
Very well. In this slide, you can see the healthcare indicators, the expenditure that is done in some countries. It's valid for 2016. Pay attention to this. It doesn't mean that it's much changed since then. It might change within a parameter of range of 10% here or there. I don't think that it matters so much because anyway, for 2018, I think the numbers are not ready yet, or were not ready in the beginning of the year when we did this research. But you can get an idea that in the state of Romania, the situation is that in 2016, the government has spent 432 euros per year per person on health. And you have here other numbers to show what happened in the United Kingdom, for example. And you can see the difference. So it's almost 10% or even less than sorry, a bit more than 10% from the annual expenditure. It's very, very little. And as you can see, you can probably see that the red part of is showing the Central Eastern European numbers as opposed to the west side of the. Now, I don't want to be crude because almost in every parameter that you are comparing the Central as Eastern Europe to Germany, it's a little bit unfair. We all know that there is a degree of unfairness to compare England, which is a country that has a big history of health, which, by the way, in the recent years has been dropping a bit, but to Romania, that has been under the hammer of the medical regime for 50 years, and then after it's been released, we all found the medical system in its ruins, and ever since then it did not recover much, because the amount of money that we need in order to recover the health system is huge. So I'm not angry at the government that they are spending only 430 euros per year per person, which is really ridiculous. If you call the doctor and say, "Good morning, doctor," and there should be a doctor on the other side to pick up the telephone call, that is already a cost of 400 euros. So where is MRI? Where is emergency? Where is hospitalization? Where is blood test? Where is X-ray? Where is consultations? Where is operations? So hear me out now. The heart of the problem, which I would like to see just fading away, is the habit of the thinking that the Romanian government is the master of our health. The responsibility on the public health is on the government. This is okay, but it's not okay that the government is responsible for my health. The responsibility for my health has to be with me, has to be mine. And if you just stop somebody in the street and randomly ask him, "Who's responsible for your health?" he will say, "The government." And that is the difference in the philosophy of how people treat the healthcare issues in the west side of the continent and in the east side of the continent. And it's a crucial thing. And this becomes a very serious problem when the government is not telling the truth. The truth should have been that the government would come to the public and say, "If you want better health, we can give you, just pay the taxes for it, that's it." It's very simple. The idea that the Romanian government is trying to perform is to keep this promise. I know a very big professor who was a minister of health in your country, who is calling this the big lie. The big lie is that the Romanian government is still saying, "I am responsible for your health," and it knows how to keep the public in some kind of a continuous hope that things will get better. This is not true. Nothing can get better. If you look at the numbers, if you look at the budget, if you look at the growing need, the amount of aging population in the society, and the growth and demand of high-class health on the public money, please explain to me from where are they going to generate the funds that are going to recover, restore, renew, refurbish the health system. So when they see that they cannot answer this question, they have trick number two. They say, "We are reforming. We are creating a reform." And this reform, as you all know, and I'm sure you remember, is going with us for years and has been in the headlines, on the internet. The government has done reforming already many times, almost in any country. And this reform has no end. And after the reform is finished, you find out that actually nothing changed, or even if major rules have changed and new laws and many things have been different, the practice for the citizen on a day-to-day basis is the same. You are going to the doctor and you have a difficulty to get an appointment. If you need some imaging procedure, you might need to wait something like 6 months or 4 months. And that sometimes is going on with suffering or pain or life risk. And so you see that there isn't any progress. So it's about time to look for something else. As we know, the budget is not going to arrive. As we know that soon nothing is about to happen. That the miracle that everything is going to be okay will not happen. Now let's add to this equation the recent COVID-19 story, which is going to put a very, very heavy additional burden on the same system that arrived to this crisis already lagging and under a lot of pressure. So somebody can tell me from where this money is going to come from. So obviously this is impossible. So therefore, I'm sorry to tell you that the only solution that is known to mankind in this situation is private health insurance. That's the only solution, because it is the only way that the individual, for a reasonable amount of payment, can take the responsibility over his own health, and if needed, he can have the support of a big insurance organization that can pay off for anything that he needs, and then when he will be able to get service in real time and anywhere in the place of his choice. This break is supposed to see if there is anybody still alive after the speech.
I'm alive and I have a question.
Yes.
Good morning, Mr. Levy. My name is Ramona Tufaru and I am a business development trainer. Our main industry is insurance field. And I totally agree with you that in Romania, there's a habit of thinking that others must take care of our health. So I'm wondering, what is MediHelp doing in terms of changing this thinking about who's taking care of our health?
Good. First of all, this is a good opportunity to say good morning to John Clear, who is with us.
Good morning, Zahal. Nice to see you. Good morning, everyone.
John Clear, just
pleasure to join.
He's always very, very quiet, and he will never make himself seen and put in the front. But I can tell you that John is one of the European best experts in health insurance, and I know him for a long time. It's a big honor that you chose to come on board today, John. It's very, very big honor, really.
As I say, I think you're flattering me. But thank you, and thank you for the invite. It's really interesting.
If you judge that I say something silly, don't raise your hand, please. Don't do what you always do for me. You have to pretend as if everything I say is right.
Exactly, in this forum, yes.
All right. The question regarding who is going to take care of your health, probably doctors and professors and clinics and hospitals. That will not change. There isn't any other trick in the book to offer you the daily medical care that you need. The question is the question of the accessibility, the freedom of choice and freedom of movement. It means that if you have chosen to get private medical care, you will not have the barrier, the financial barrier to afford it. That is, of course, if you have the right insurance plan. So if for example, somebody needs an operation, and sometimes that can be a very intriguing situation. If your child needs to be operated, or if your wife needs to be operated, or if somebody in the family has breast cancer or other situations, then you want to know that you can get everywhere fast. Now, look, I don't want to sound very dramatic, but I'm sure that each one of you knows somebody in your circles, in your families, in your friends, in your employees, who have been suffering from things like this. And you know that this is very, very nasty. Very, very nasty. What you really want in a situation like this is easygoing second opinion, so you can hear somebody else's opinion and know that it's a high-class second opinion, and not to pay 10,000 euros only for this. And then you want to know that you can access the best medical facility that can deal with the issue of your loved ones. And that is with no delay that can risk the life or prolong the pain. That's what you want to have. And I'm afraid that if you turn to the national healthcare system, especially now or in the foreseeable future, you might find it difficult to execute it in that speed and in that level. And I don't want to sound very unfair towards the medical teams in the health systems. The doctors in Romania are great. I know many of them. As I think most of you know, I've built hospitals in your country and medical facilities, and I've been in healthcare for 20 years. I worked with the Romanian doctors and with nurses and with other medical staff for many, many years. And I'm very, very impressed with the level of knowledge. Then they go away with a brain drainage to Western Europe, and they're accepted, admitted easily in France and in England and in Italy, and they become superstars in these countries. Why? Because they're good. They are very good. They're dedicated, they are educated. The health system, the health education system in Romania knows how to produce excellent medical stuff. But the system is not good. It lacks resources, it lacks leadership, it lacks efficiency. There is a degree of corruption, and all that together, plus the under-budgeting, creates a situation that is just not accessible. It's just not a nice place. Now, I'm not trying to say that in my country or in Germany, a hospital is a nice place. But you want to really, it's about time that we acknowledge that our lifestyle in this country, our philosophy of living should be that there is a degree of mercy and care for the needy. There must be some kind of compassion to a person who comes to a hospital in the time of the need, in the time of his vulnerability, the time that he's most weak, in order to get help from somebody else. And then the system is not allowed to grind him down the way they do now. This is very, very nasty and somehow got to be accepted by the public. Until it happens to me, I know about it, but I'm not really out of my skin for it. So I think that in that respect, I cannot change the world. I cannot turn around the situation, but I've been meeting with ministers of health and with country leaders, with ambassadors and with chief doctors and with hospital managers. And I've been preaching for a few things. Number one, to promote health insurance. Promoting health insurance is a win-win situation that for some reason is not yet getting into the awareness. I want to show you another slide from this Athens conference that I just did in February, and to show you what can happen if the government is going to promote health insurance. You all see my screen, I hope. This is what I think you are now doing. And if the government, I'm showing you on this diagram, let me try to make it a bit bigger. You see? Do you see? Hello?
Yes, but everybody.
We saw it.
We see, but we're all on mute.
Everybody's on
We
mute. Okay, I thought maybe
can't interrupt you.
Maybe I thought maybe I'm talking to myself, which is sometimes a good thing to do, but
See?
so
Okay, we see it.
very well. So if the government is going to invest in the legislation basis to have health insurance illegal and it has the legal infrastructure for it, and that it will have the fiscal infrastructure, tax reliefs, etc., then the health insurance market will grow. And then the middle class people, who are the natural customers for health insurance, because the poor people cannot afford it and the rich people don't need it,
Yeah.
will have unlimited access to many medical providers who will service these people on our money. We shall make money, we shall pay taxes to the state, and the circle can close here, because the state will relieve from getting the taxes from two directions. The state will gain taxes on profits of the medical insurance companies, And the state will get taxes from the growing medical provider industry that will have more customers paid by the insurance in order to generate the revenue that they have lost on the tax facilities. What will that bring? There will be a little change in the society as well. The healthcare budget will be able to be directed for those who cannot afford health insurance. It means the upper class, we decided, do not need health insurance. That's because they go to the private healthcare anyway. The middle class will have private health insurance. They'll go to the medical providers, pay them, and they will not go, or will go less to the national healthcare system. And therefore, the national healthcare system will have more funds to take care of the lower classes who cannot afford those facilities and they cannot buy health insurance. Now look, that might not go along with philosophical views of communism and socialism. I'm sorry. If you think that health should be equal to everybody, and this is the way you want to live your life, you may be right, but not very practical. The truth is that health now is a matter of money. And before you, it's better that the government will act fast on making the facilities that I've mentioned. Otherwise, we might end up, just like the United States, to have a medical anarchy. And this is the situation now in the United States. I don't know if you know what's happening there. You might think that in the United States, it's only a matter of paying from your own pocket for medical care. It's much worse than this. If you come to the emergency room and you don't have health insurance, you might have problems to be admitted. Maybe they will admit you in the end, but it will not be an easy procedure. And that can take time and sometimes even create loss of lives. There are many cases like this. Go into the internet and look into some posts on the social media about cases in the emergency rooms in the United States, and you will be shocked to see what is there to be. This is still the socialist situation. The socialist system that we are on still is good enough not to agree. So I think that if we are not going to go to this direction, and the abonnement will continue to be the ruler of the land, my expectation is that slowly we'll become victims to medical anarchy. And in the end, it will go out like this, that whoever will not have money will not be able to get service at all. And there might be a total collapse of the national system if something like this will not be done. The idea that the governments will find the money to refurbish the hospitals and make everything new and build new hospitals and bring medical equipment and technology and telemedicine, I don't want to use harsh words, so I will just say it's not realistic.
Zahal, I just intercede because as you're on this point, I had a question which I sent to your team, but they said they prefer me to ask it live. What advice would you give the Romanian government in terms of fiscal and legal reform in order to allow your model to become a reality?
So in Romania, if you are giving your employee health insurance, your tax benefits will come up to 400 or 450 euros. Maybe one of my team can correct me, Flori. Is it 400?
400 euros.
400 euros.
Yes.
It is very little. The average price of a policy is 1,500.
You're talking about tax deductibility up to 1,000 as opposed to 400.
Deductibility with no limitation should be a must. With no limitation. Okay. The short eye of the government and the narrow sight might imply that this is an investment that is unaffordable for them. And as I said before, it's not true. I can show in numbers and I can support the idea that in the end, there is a clear understanding that it grows the private medical industry, it grows the healthcare industry, it grows the private medical insurance industry. They all flourish, pay taxes, people get their medical care, and everybody's happy. There is another thing. In countries where health insurance is sold, usually the private health industry is growing, and the technology and the benchmark of the quality of the service is growing with it. Because today, for example, many of our customers are going to Austria or Israel or the UK or Germany in order to get medical care. That will not be the case if everybody will have health insurance in Romania. Maybe not everybody, but a big portion of the population. Not to mention that if many people will have private health insurance, we will be able to sell it for less than we sell it now, which is also a very important point. The cost for everybody will decrease, the healthcare industry will grow and become better, and the government will have more free budget to deal with the national healthcare system to those things that will never become a private. There are some medical territories, let's call them like that, or domains or realms that will always stay in the possession of the government. For example, emergency service. For example, maybe maternity, and maybe other things, doesn't matter now. The government might say, this is territory, my territory for, and I don't want to give it away to any private hands. Major disaster intervention, road accidents intervention, many things that that might be still in the hands of the government. I still think that the government can own a few hospitals, but it's not a must. PPP, like private-public partnership, could be a very good way for the government to create new hospitals, new medical care, and let the Ministry of Health, listen to this, the Ministry of Health should be a regulator, not an operator. This is the essence of the whole story. And the tax facilities should fuel the motivation of employers to give it to their employees as a benefit and not to pay benefit in kind. And so the industry will grow and it will create a win-win situation for everybody. There are no losers in this. It might reduce a little bit, or maybe not a little bit, the portion of the business of the medical abonnement in the country. And by the way, it's an East European idea, just that you know. The medical abonnement, as you know it, a subscription medical package that is given to you in the Medicover or Fondator or others, is not a very popular scene in France, England, Germany, Israel, Australia, or Japan. This is hardly seen. This is something that is an East European invention, which I think is already obsolete. But because of political lobbying and because of other reasons, they are still keeping it in a very, and by the way, this is tax deductible. What's the difference? Why is a subscription in Medicover should be tax deductible in full? And if I'm an employer and I bought it for all my employees, I get full tax deductibility. But if I bought health insurance for all my employees, I am limited to 450 euros. Why? What is the logic? Other than if you, of course, not going to be dealing now with political pressures and lobbying and things like this, which we're probably not going to now. So my read is that it's time for a reassessment of the situation. And I think we are market leaders in private health insurance. We are the biggest. And honestly, I don't like it. I would like to see other competition. I want to see other competitors grow their business in private health insurance and assist us to educate the market. And I would like to see the industry grow. And I would like to look right and left and not to see that I'm alone in this, or we are alone in this, but to see other companies, other good companies. There are great insurers in Romania, in Central Eastern Europe, very nice insurance companies that are honest, they are big, they are very, very good and clever, and they should grow this business of private health insurance with no hesitation. I don't know, Charlie, if when you asked the question, you anticipated such a long answer, but I did my best. I did my best not to miss out anything.
I thought it was complicated, but you've mentioned what you would advise them. Is there any reason why you believe that they haven't taken that step? Because the way you presented it, it seems to me to be a no-brainer.
Well, I don't.
Or is that a politically sensitive question to ask?
I think there is a few things. First of all, it's a politically sensitive question. Second, look, one of the things that I think we are all suffering from is the lack of leadership in the health system. Leadership here is a very important issue. Unfortunately, in the last 20 years, the state of Romania had more than 50 health ministers. Maybe I'm not right about the number, so you will not be angry at me if it's not 50, but 47. It's unreasonable. And there is no build-up of expertise other than a few characters in the health system that I know. They're very good. They're also suffering from political pressure every time the government changes. I don't see continuity. I don't see strategy. I don't see an idea that is kept, and the successors and the government that is going to be elected is going to follow and keep. And so you know that something that is good for the nation is going to be developed for years after. Most of the most impressive things that happened in Romania in the last 20 years were created by private investors. And I'm one of them. It's not by the state. The best thing that the state has done is just let it be. Or allowed or made the legal facilities like what I've done when I brought Euromedic into Romania. The best help that the government has given me then is to create the legal facilities to allow it to happen. But that's not enough. The government should be active, and there should be leadership, professional leadership, that has to lead the way and avoid good doctors to leave the country and make sure that they are paid well. Another thing that I don't know if it's politically correct to say this on a recording, I would like to see this shpaga going away from our lives. The fact that there are still situations that a person, I have this in the family of my lady partner, which one of the family members is very sick. And he comes from a poor region in the country. He cannot move without an envelope with money. Even today, there is no way in the world that renowned doctors that have worldwide name are still talking to you after you have put on the table an envelope with the amount of your choice. You can do whatever you like. You can give them, you cannot give them, you can give them little or more, but you know very well that their so-called attention to you will be influenced by the amount of black money that you pay. This is something that really, I feel sick every time I talk about it. When I opened the first Euromedic Center in Arad, I have placed a big plaque and I wrote "No Shpaga here." Everybody thought I was crazy. They didn't believe there is such a thing, that doctor, and I said, if we ever catch, I used to take doctors for an interview and they say, how much money do you want? I want a 1,000 euro salary, just for example. And I said, okay, you will get 1,200. I'm giving you 200 more than you asked. This is the shpaga. Take it in advance and leave my customers alone. Don't ever, if I ever catch you taking a penny, you're out of the game immediately. This is a sickness, the most ugly, low standard, sickening thing that doesn't go out of our lives. By the way, even in the police, it's already disappeared. You must all admit, when I came to Romania 20 years ago, I had a Mercedes. It was a car that used to shine in the eyes of this policeman. I could not cross the city without being stopped 3 or 4 times if I went out to a restaurant on the way back in the evening. They would not care about my speed, about the alcohol. They would put a story on me, so I give them $20 and then let me go. This has disappeared. You don't have things like this anymore in Eastern Europe. Even in Bulgaria, you don't see this anymore. But not in the cabinets of the doctors. They still collect money from the poorest people in the nation. So all of these are the symptoms, are the worrying things. This is lack of leadership. I didn't see yet the Minister of Health that have stood on the television and said from the 1st of the next month, you are not allowed to take any gratitude in money or in any other way without declaring it, paying taxes for it, and this is not allowed and outlawed, and that's it. And to create the sentiment around it in the public that they should not support it, they should not do it, and they should not be a part of the crime. That has to stop somewhere. So all those things put together is what the government can do. Under the situation that we have the COVID-19, which is inflicting and will inflict a lot of additional expenses on all of us, we will have to complete this by taxes. And therefore, again, we close this circle by saying you should take the social responsibility. You should come and do business with us only through the social responsibility factor. You must see that there is no other way, and every other way that people start trying to invent, to improvise, is usually not going to work. And the last slide that I showed on this nice conference that I had was this. It's not that you come to do business with us. You also have social responsibility with us to convince everybody around you that this is the right direction. And not only with us, I would love to see all the other insurance players in the market come and join us and have a nice industry growing, and this will be for the benefit of everyone.
Zahal, thank you very much. Can I abuse my position by asking one question? I completely agree with you that we will be much better without Spaga, whatever you want to call it. But I can see that where the logic of the system you've outlined, there is the old saying that prevention is better than cure. Do you think that's the case here? How can public health prevention fit into a method of curing people that's funded with all the various players you've outlined?
For sure, prevention is better. And I think that this is a call for us. I think the prevention measures in the policy that we are selling should be more generous, such as annual healthcare. We have those facilities. I think we should improve them. But yearly checkup on our policies, for example, for sure, is creating a situation that the obstacle or the psychological barrier from having prevention measures on your health are much lower. So the experience shows that if you have private health insurance, you will probably be urged to use it, or you will be more comfortable to use it in a much earlier stage of the symptom rather than apply. People go to the hospital on a delayed manner. We know this. They go to the hospital when there is no choice. People go to the private doctor when they have an insurance plan on the first warning, on the first symptom. And this is something very important because, and also good for us. I remember that once we sat with an insurer, and I think Laura, who is here on the call, was with us. And the insurer, when we said that we want to add checkup, they've said that they are afraid that people will go and do the checkups and then we will have to pay for it. And I said, yeah, let's pay for it. Let's be happy to pay for it, because this is going to enable us to have detection of problems in a much earlier stage, and therefore we will have to pay a much smaller fee after to have the cure and to deal with a person's problem in an early stage rather than when he's going to the hospital already half dead and we cannot do anything anymore. So I think prevention is important. Health insurance is definitely a good way for prevention. To say that the national healthcare system is going to invest now in prevention would have been a great idea. I don't see that this is about to happen. It looks to me like euphoric, and therefore, again, I think it is more a call for our industry to develop the prevention culture and the prevention options and facilities within the insurance plan.
Thank you very much, Zahal. Are there any other questions, please?
Yeah, I have a Zahal. Great to see you, my friend. Thank you very much. A couple of thank yous. Thank you very much for your very kind words about the Chamber of Commerce. I know as a director, along with Neil and Charlie on the call, that means a lot to us, and we really appreciate that positive feedback. I think it was a little bit flattering. I think there's lots of things we can do better, and we're always working on that. But certainly, and a call, a presentation like yours, I think was really excellent and very useful for many of our members joining today. So thank you for this. My question is specifically on COVID and health insurance. I assume, having not, as you know, I've been involved in insurance for many years, and for a short period of time, health insurance. Is there coverage for COVID symptoms and sufferers, not just to recover and get better, but also in terms of getting tests done, for particularly now, because people are starting to travel more, and quite often I understand that authorities in customs are asking for certificates to see that people are negative.
Yes, well, first of all, I'll make a comment about the chamber, what you said, that I'm flattering the chamber maybe in the end of this conversation, because I want to encourage and enforce what you're doing and compare it to other things. I'll drop a word about this in the end. Regarding your question, and you know very well, because you are a renowned expert in insurance and you've been in this market for many years, one of the leaders of the insurance industry in Romania. You are always protected for a major calamity. So just as like in the insurance policies you have composed and you have managed, you were always protected for property insurance, for example, from a situation of a civil war or uprising or a total calamity that can wipe off the insurance economic balance.
Yes.
In the insurance policy that we sell, there is also a protection of this kind, namely in total worldwide pandemic. We never thought about when it was composed. Nobody's even thought about such a unimaginable situation that we are all in now. But there is a paragraph like this in our insurance plan that was there before, but with advice with our reinsurers and with a good collaboration with General Insurance Company, we have decided to cope with this and not to execute this paragraph and not to cancel, not to lift off at least for now, we are covering the risks of the virus. That means if you had to go to a doctor or you had to get any medical care, then we would cover for your expenses and we will care for you just as if you had anything else.
Okay.
In Hungary, I know that the country manager of my company has decided to pay for tests. And we are actually making payments for tests in the state of Hungary ever since, as of 2 weeks ago or something like this. In Romania, I want to just share and admit my shame that I don't know. Let's ask Laura, is she still with us? Or one of the managers to tell me if we are covering for tests or are we not?
Yes, we are. Can you hear me?
Yes.
We are covering tests. I had a situation with one of my clients who was traveling from Belgium to Romania, and he had this feeling that maybe he's a suspect, and he wanted to get tested. He wanted to know if he's covered. So Alexandra, my colleague from customer care, reassured me once again that in case he needs to do the test, he will be reimbursed. So we are covering that. Yeah.
I mean, this is important for business people traveling at sort of short notice to know that firstly, they need to know where they can get the test done and that they get a certificate that will be recognized or a result sheet that they can present if necessary, if they're asked. And of course, also they'd like to know in their companies, if they're paying for their health insurance as part of their employment package, that the expense is covered under the insurance, which I think, I mean, Regina Maria, I had a test done and it's about 370 RON. So it's not cheap, I would say.
It's not cheap, and in Romania is better anyway. You're paying outside, you're paying in Belgium and Holland around 200, 250 euros.
Wow,
and
that's 3 times more.
Yeah, and it's not just about that. It's about the fact that in Romania, you are covered. If you go to the state, you have to be hospitalized. It's not the case in every country, especially if you're not a resident. So there are costs regarding hospitalization in case of need. If you need to be intubated or anything like that, again, the insurance is covering the treatment and the hospitalization also. So it's a big, let's say, it's a big step for Generali to do that. And yeah, I think most of the big insurers realize that people do need some faith.
I think so. I think to refuse payments on something like COVID, which is completely fortuitous, which is the whole point of insurance, I think it would be foolish to decline anything like this, because it would be very unsupportive and it wouldn't be good for the industries. For insurance.
No, of course not. But it's a general exclusion in any case.
But also, please remember that we are dealing with a situation that we are learning as we are rolling. We don't have any recipe for this situation, and therefore it's you need to be very attentive, and you need to be very careful also not to do anything that will ruin the very delicate balance of the profitability of the product and the loss ratio. We need to be very, very careful. While we were talking, I am now seeing that on the chat I had some questions, and I'm sorry that I didn't pay attention to them before, but Philip has asked me about the Romanians do not understand the benefits of private health insurance and the catastrophic of the health. I hope I'm getting it right. I'm just reading the end of the text here, and you're right. There is a lack of understanding, and what can I say? I don't know what to do. I don't have the resources of filling in the country with billboards and like Coca-Cola style of advertising of every 10 minutes all over the television stations. Nobody is doing this. Nobody can afford this. What are we doing? We are doing a lot of webinars, like with the one we have now. We have the social media. And when I talk to my great team, with some of them you see here, which I think are the real engineers of our success, I always repeat and say, as the leader of the gang, I think that I have the responsibility to remind us all that we have social responsibility, we have social mission. We have to be honest, we have to be transparent, we have to execute our business in a high integrity, and to show the example for the rest to follow, and as much as possible to explain to everybody what is the essence and what is the benefit, and why health insurance is a win-win situation for everybody, and that can relieve a lot of the stress and the burden that is now has now landed on the health system. And the more you guys will help, and the more webinars we will do, the more exposure we will do, I think it will go faster to make the Romanians understand this. And in the end, I think there will be no choice but to go to this direction. Just one more word about the chamber. I wanted to know that you've been answering what you thought was flattering in a very nice and polite way, but honestly, I don't know of any chamber in Europe, and we are in touch with the Americans and with others, that they are doing so much in such an intensive manner and touching so many businesses in all walks of life in such a generous and high-class way. So I really think it's not just giving you compliments. I really think you're great.
Nice.
Good. Thank you
Thank
very
you
much.
very much indeed. I think we're pretty much on time now. So unless there are any other final questions or other thoughts that you have, Zahal, I should wind things up. can I say thank you, James, for saying you're the best person to do so, being an insurance person, to say thank you to Zahal for his very kind words about the chamber. Again, if there's more that the chamber can do for you, please let us know. And that applies to everyone on this call. Madalena, I think you want to talk, or Anna, if you want to talk about our next event we have someone waiting to come in. Let me just let her in. Madalena.
Sorry.
Madalena, do you want to say anything about our next event with the chamber?
Yes, hello. Hi, Neil, and hi, everyone. Thank you, Zahal, for this very interesting presentation. Our next event, so we have one on Thursday, on the 4th of June, with Severin Sânzianu from Premian. It will be how to do efficient business networking online. And next week, you're also going to have another webinar together with the Belgium Chamber on leadership talks in 2020. So in case you find them interesting, kindly find out more and register. So thank you.
Good, thank you very much. Unless there are any other questions or comments, Zahal, can I say again, that was an extremely engaging presentation you gave. Thank you very much indeed. It'll be discussed a lot more after this, I'm quite sure.
Very well.
Thank you very much, and good health.
Thank
and
you.
I hope the weather's better for you in Israel to go down to your local beach than it is for us here, which is looking rather grey in Bucharest. I'm told sunshine is there to help your health.
Be healthy, everybody. Thank you for listening. It was a great talk.
Thank you very much.
Thank you very much. Bye-bye.
Thank you all very much indeed. Have a good day.
Thank you.
Thank you.
Bye-bye.
Bye.
Thank you. Bye.
Bye-bye.